What's up, everybody? Welcome to Political Fight Club. I'm your host, Robert Durden, and this episode is about a study that I saw that just came out on May 6th that makes me write about something I called back when the pandemic started. So I was kind of doing some math when this hit back in February, and I wasn't on YouTube at the time. I was just kind of screaming on Facebook was all I used back then. And I said that if we don't get this under control, that it's going to be something like 1 million deaths come next May, early May. 1 to 1.2 million was where I was kind of ballparking it. And as you guys know, the actual death rate right now is something like just under 600,000. It's like 580,000. So I was way off, and I've been wondering, where I made my miscalculation. But this study seems to suggest that I'm not actually very far off. And you guys got to remember, Biden and Trump and whoever is in power here in the United States, they have a vested interest in making sure that the numbers stay down so they don't look like they're doing as bad of a job as they are. So a lot of times these numbers that are officially coming out are way deflated from the actual numbers. So studies like this are important so we can understand exactly how bad things are objectively and not just according to the data that Trump gives us. Like, for instance, if you guys remember correctly, Trump was really messing with the way that the CDC collected their numbers right in the middle of the pandemic because he wanted to keep numbers down, and he really fucked with the CDC a lot. And then he tried to give over the counting responsibility for counting all the COVID deaths and collecting that data to the government, the Department of Health and Human Services, so that he could further suppress those numbers. And I'm sure that Biden's doing some of the same stuff. So they have a vested interest in keeping these numbers down, but this study seems to suggest that I was pretty close. So what this study did, and it's on healthdata.org, and it's from the IHME, which is the Institute for Health Metrics and Evaluation, which, just a caveat, was founded by Bill and Melinda Gates way back in the day. Now, this study is solid. I looked at all the data that they used and all of the sources that they cited, and they're from good journals and from a lot of stuff overseas. So this isn't tainted, but it was from the Bill and Melinda Gates Foundation funded this entity that did this study, just so we're clear. So what they did is they adjusted the number of COVID deaths for taking a lot of externalities that aren't included in data collection right now to give us a more accurate number. And it's a very long article, so I'm going to do my best to break it down for you succinctly here. And I'm going to read to you how the 6 drivers that they picked are going to give you a much more accurate number of what the actual COVID deaths are, okay? So the 6 drivers that we have here, right here, they're calculating excess mortality. Excess mortality is influenced by 6 drivers of all-cause mortality that relate to the pandemic and the social distancing mandates that came with the pandemic. These 6 drivers are A, the total COVID death rate, that is all deaths directly related to COVID infection. That goes without saying. B, the increase in mortality due to needed health care being delayed or deferred during the pandemic. This would be people that couldn't get into the hospital when all the beds were taken up and the ERs were overwhelmed, or people that were too afraid to go out during the pandemic and they died in their homes, and they would have otherwise lived had they been able to get into the hospital, or had they not been too afraid to go out to the hospital. C, the increase in mortality due to increase in mental health disorders, including depression, increased alcohol use, and increased opioid use. And they also included suicidal ideation spikes, which, as I've said on this show multiple times, is particularly running rampant in younger people that have had to go through this. So there's a lot of extra opioid deaths, a lot of extra alcohol-related deaths, and such that they took into account when they were calculating the deaths here. D, the reduction in mortality due to decreases in injuries because of general reductions in mobility associated with social distancing and lockdowns. So that means basically people that didn't get killed by accidents in public that, if they had been crowded into a space, it's basically adjusting for people that didn't die via accident-related injuries that otherwise would have. So this actually deflates a number. So it's good. Again, it gives us a more accurate idea of what the real number is. So E, the reductions in mortality due to reduced transmission of other viruses, most notably the flu. So that's huge. Like the flu basically was like not a thing this year because everybody around the world is more or less wearing masks and social distancing. So the flu didn't have a chance this year. So it also adjusts for that. Again, deflating the number, giving us a much more accurate number. That's a good thing. And then lastly here, the reductions in mortality due to some chronic conditions such as cardiovascular disease and chronic respiratory diseases that occur when frail individuals who would have died from these instead died earlier from COVID. So it's adjusting for the people that would have died in the year and change from other things, other chronic illnesses, but instead died earlier because they were infected by COVID. So this gives us a good idea of how they're collecting their data and how they're calculating the number, and it will give us a more accurate, I still don't think a totally accurate, estimation, but better than what we have right now. And I just want to let you guys know, 575,000 is where we're at, 580,000. When they calculated it and adjusted for all these 6 things, we have 906,000 COVID deaths so far. So I was saying 1 million, so I wasn't that far off. And I'm not saying this to toot my own horn. What I'm saying is that it's important for us to read studies like this and understand that our government will never give us a real clear idea of exactly how bad this was, because none of them want to have to actually take any responsibility for how bad it was. We live in a capitalist system that's going to allow our rich overlords off the hook, and they want to nerf these data as much as they can to make it look like they're not doing as bad a job as they did. And that includes Trump, that includes Biden, okay? This is not a partisan thing. This is an oligarch not wanting to admit that they let the house burn down around us thing. So this data is much more accurate, I believe. It's over 900,000. And for all you mathematicians out there, from 575 or 580 to up over 900,000, that's over 50% higher than is being reported officially. And if you adjusted for more things, I think that number would actually be higher. But this is, this is better, much closer, I think, than anything that we've actually seen in the actual numbers that our government is giving us. So take that for what it's worth, guys. And like I said, unless we get herd immunity in this country and globally, we're just going to start all over again next year, because the mutations and the variations are going to rear their ugly head right around Christmas, according to the leading epidemiologists in the world. So Biden did a good first step by getting behind the countries in the WTO that want to release the intellectual property rights for those patents. That's good. We'll see if they actually come through, and especially if they come through on time. Because if they, like I've said, if they finally get these negotiations at the World Trade Organization to release those patents to the world, 6 months from now, it's too late. We have like a month or two. Otherwise, these other third world countries won't have enough time to produce and distribute it to everybody, and everybody needs both. They need their vaccine and their booster, 7 out of 10 people on the globe, by Christmas, or else we're in some deep trouble come next year. That's just what the world's leading epidemiologists are saying, so don't take their word for it. I'm sure they're a bunch of knuckleheads, yeah. We need to get this under control. We've taken the first step. Let's come through. But COVID deaths are absolutely inflated in this study, or they're absolutely, I think, more accurate, and they're so much higher than what we're seeing in the mainstream media. So don't kid yourselves, guys. This was really awful, and is going to continue to be if we don't get our heads out of our asses. So keep fighting the good fight out there. I've got at least 2 more episodes coming later. We'll see ya.